Hi, everyone. It's a pleasure to uh, have you all here. I am Dr. Ariel Ostad, and I'm so glad to be here with you and to be sharing with you my experience. What I like to do is just really wait just a few minutes to make sure everyone is in, and then we'll get started. So we are recording this. Thank you for that reminder. So we are recording this webinar for those of you who may not be able to stay on, and we will absolutely send that to you and share that with you. Um, I hope everyone's having a beautiful day. And just to share with you some of my experience, I've sort of been back in the office since a year ago, and obviously we've been social distancing, and certainly in the last few weeks, I see an incredible change and energy in the city. I see how everyone is in and about. I see how the streets are crowded. There's more traffic. We are seeing more and more of our patients coming back to the city, or at least visiting to get their medical care and going back. Um, so I'm just excited about and optimistic about what is happening in our community. Uh, so with that said, why don't we just begin uh, begin this webinar? So I the title of this webinar is The Effect of Emotions on Skin Health and Skin Aging. And this is something that I've been incredibly interested in as a physician. I've been in practice, for those of you who know, for over 25 years. And it is something that I have seen over and over again in my practice in terms of how our emotions really affect our skin and cause skin disease. And um, it's something that truly wasn't taught to me in medical school nor in my training. Really, Western education is really about making a diagnosis, giving somebody a prescription, and then basically telling patients what they have, and then uh, and generally if it's like a steroid cream or an antifungal cream. Um, but it never really left me fulfilled, because I really realized over time that so many of our skin conditions that we encounter, there's truly an underlying emotional conflict, emotional stress. And it's something that I began at least bringing to patients awareness over time. And it's something that I think is really an important part of the healing process, because I think if those conflicts are not resolved, the skin condition can return. And certainly we're not really making any headway in helping somebody. Um, Everything became even more amplified during this past year with COVID. And it's something that there was some silver lining for me in terms of what COVID brought. And truly the gift and opportunity was for me to study this connection of emotions and skin health even more, and to try to really go deep into it. So during those times where the office was closed for about 3 months, and certainly once I did get back, I did really delve into just increasing my own education about how our emotions really affect our daily lives. As you know, with COVID, we're really in survival. Survival emotions are more based on flight or fight, and they just kind of get us really in a downward spiral of negative emotions, which is based on fear, based on resentment, anger, worry, and those things really ultimately can create thoughts that just uh, make us even more negative, and that sort of emotional negative loop can lead to disease. So I've studied this even further, and I decided to really sort of bring this out into the open by studying it, and therefore bringing it out into my patients. And I want to tell you that in the past 25 years, I've seen how emotions really affect not only our skin, but really and the aging process. I see a pattern in terms of the patients that I see. I adore my patients, but I can sort of feel their energy. I can see the stress on their skin, on their body, and their energy. And it's something that I want to sort of talk to them in the room, just even bringing it to light so that that awareness can help them. And I decided to just put a webinar together because I think it is something that needs to be a paradigm shift in terms of treating patients, where it's no longer just about looking at someone and looking at a condition that they have, whether it's a rash, something that's itchy, or even aging, without really discussing how our emotions influence that. So with that said, I just put a PowerPoint together and I wanted to just share with you. And I really hope to just kind of keep this really simple. I would love for you to enter your questions into lower in the bottom under Q&A. I want to answer all your questions. This is truly an incredibly informal thing. And with that, let's just begin. So let me share with you my screen. Okay. Again, so the title of the talk is Effects of Emotions on Skin Health and the Skin Aging Process. For those of you who don't know, I'm a clinical associate professor of dermatology at NYU Langone. It's where I teach residents dermatologic surgery. My practice is truly, for now, really focused on cosmetic dermatology, really improving, the aging process. I obviously treat also skin cancer. For those of you who know, I'm also a Mohs surgeon, which means I'm a skin cancer surgeon. I do a lot of reconstructive surgery on the face. And again, this is something that over 25 years of doing this, I realized the power of emotions. Let me just define to you, let me just kind of define with you what I mean by emotions. There are really positive emotions, and then there are negative emotions. Negative emotions are anger, frustration, rage, negativity, sadness, and versus positive emotions that are really filled, that are like gratitude, joy, love for life. And those things really have a tremendous impact on our immunity, on our health. So with that, let's begin. There are common conditions caused by the influence of stress. We all know how really there's an association between migraines, certainly depression, anxiety, dementia, cognitive impairment, even sort of beginning to be forgetful, certainly lack of sleep, insomnia, high blood pressure, heart attacks, a broken heart syndrome, where unfortunately a dear family member passes away, and then people can really get sick, and God forbid, like they can die. And then there's digestive issues such as irritable bowel, such as Crohn's disease, stomach ulcers, and autoimmune diseases like lupus, multiple sclerosis, and certainly chronic susceptibility to viruses and infections. I've seen over the last year that I feel truly people who have a positive mindset can really improve their immunity, and maybe they're even less susceptible, let's say, to COVID. So there's this important influence of stress on our general health. Now, how does stress and negative emotions affect our general health? What is the mechanism? And the mechanism is really, to try to simplify it, is there's really two pathways where negative emotions, as we define negative emotions as just conflicts, unresolved conflicts, anger, frustration, rage, things that are bottled inside. They really, through two pathways, lead to issues. One is through what we call a hormonal pathway, where our brain that's experiencing negative emotions causes our adrenal glands, which are glands within above our kidneys, to release what's called cortisol and norepinephrine. Cortisol and norepinephrine lead to inflammation. And when that is chronic, we have this elevated cortisol, norepinephrine, basically production, which leads to chronic inflammation within our body. And that can lead to lowered immunity. Certainly lowered immunity can potentially lead to, whether it's skin cancer, whether it's general cancer, whether it's susceptibility to infection. So that's one pathway, which we call the humoral pathway or the hormonal pathway. There's actually a second pathway where stress affects us, and that is through our autonomic nervous system. This is an important pathway. The other term for our autonomic nervous system is our subconscious. And I want to talk to you about this. So autonomic nervous system is really divided into two pathways. There's the sympathetic to the right versus parasympathetic. Now, it's called autonomic nervous system because it is not under our conscious control. This is something that's involuntary. It is a way where our body achieves what we call equilibrium or homeostasis, and it kind of creates balance in our life. If the autonomic nervous system is out of balance, it leads to disease. And I will talk to you about how that happens. So the autonomic nervous system is really divided into what we call the sympathetic pathway, and that is what we call the fight or flight response. When, let's say, our ancestors, if they saw a tiger, we would basically go into this flight or fight response where our body secretes The sympathetic nervous system secretes epinephrine and norepinephrine. It has certain consequences where all of a sudden physiologically we feel our heart rate go up. We feel basically our body just kind of, the breathing becomes shallow where we're not breathing properly. We start getting sweaty. We start getting clammy. Then the parasympathetic system basically comes in to balance that. The parasympathetic system is what sort of calms us down. It's really mediated by what we call the vagus nerve. And that has basically the ability to lower our blood pressure, to be able to increase our digestive enzymes, so our digestion goes into normalcy. With chronic stress, our sympathetic system is equivalent to having the gas pedal on while you're driving, versus the parasympathetic are the brakes. So, but if there's an imbalance in terms of stress, our sympathetic and parasympathetic system are basically not coherent. They're not talking to each other. So it's like putting your foot on the gas pedal, meanwhile you're on the brakes. And that means that you're not able to basically normalize functions. And that's what leads to disease as well. Again, autonomic nervous system is not under our control. So if you're having negative emotions, basically the sympathetic system comes off. If you're angry at let's say your boss, you're angry at your partner, or something happened to you, or someone did something wrong, you go into this fight or flight mode. Or even during the COVID time where we're under survival. So our sympathetic system kicks in, our blood pressure can go up. And then if that process is chronic, we become in this hyper arousal state. Our parasympathetic comes in, but at some point there's that imbalance. And when we're in that survival mode, that can lead to disease of any organ, depending on what we're susceptible to. So that is really how stress affects our body. Now, there are types of skin conditions that are influenced by stress. And I've seen this over 25 years. And majority of people who come in, when we kind of delve into what is the actual, what is causing your skin condition, generally there's absolutely an element of stress. And hopefully by bringing that to patients' awareness, patients can actually begin to hopefully work on that. Now, common skin conditions that are influenced by stress are acne, rosacea, eczema, psoriasis. I've even seen skin cancer be related to stress. I've seen patients who come to me who I've seen, let's say for skin cancer, all of a sudden they come in after a year or two and they have a few more skin cancer. And certainly we know skin cancer is primarily caused by sun damage, but yet because of the stress, the immunity is affected and more skin cancers pop up. I've seen a host of viral infections, whether it's shingles, herpes, hair loss. In the last year during COVID, I've seen numerous patients come present to me with hair loss due to stress. And lastly, something that I'm really interested in is how we can actually cause accelerated aging, rapid collagen loss due to aging, due to stress. And the basic underlying mechanism for these skin conditions are that, again, the two things: under chronic stress, our body produces cortisol chronically, norepinephrine. That causes inflammation in our body. There's scientific pathways that have been proven, and I don't want to get into the nitty gritty of it because I certainly want to keep you interested. I will talk about that in a few minutes, but ultimately with chronic inflammation, you can get rashes on your skin, you can get acne, and ultimately with chronic stress, your immunity can be compromised, which can basically prevent your body from repairing itself, leading to further disease. Now, the question becomes, why does somebody get acne? Why does somebody get skin cancer? Why does somebody get eczema? Why does somebody get high blood pressure? Why does somebody get irritable bowel syndrome? And that is where our environment influences our genes. And that is the field of epigenetics, the influence of environment on our genes. We have certain genetic predispositions. Our body basically is keeping those genes in what we call a repressed mode. But with stress, there's basically an upregulation of those genes. And then what can happen is, depending on our environment, for example, if you've had a lot of sun damage, there is changes within your genes, such as histone binding, such as DNA damage, such as what we call methylation, that can cause a gene to present itself. So depending on our underlying genetic predisposition, stress can cause manifestations of those genes to be upregulated and be presented. So the environment plays a part as well. This is a picture of acne. I wanted to show you some pictures of these conditions. Rosacea, where we get flushed, ultimately leading to broken blood vessels. We can get acne with rosacea. I've seen so much acne and rosacea in the last year. And I certainly believe not only masks play a part, but certainly stress plays a big part in it. Eczema, you can see eczema is really these sort of scaly patches that develop. And then the last picture at the bottom right is a picture of somebody with cold sores. And with stress, as we all know, you can get cold sores. These are pictures of skin. These are pictures of skin cancers, whether it be malignant melanoma, whether it's basal cell carcinoma, squamous cell carcinoma. And again, numerous times I've seen patients present to me with these conditions. And when you sort of delve into their underlying issues, you do find that at some point they've had increased stress in their life. So that's something that unfortunately plays a part in progression of that sun damage. These pictures of people with hair loss. These are pictures, at the top left is a picture of what we call telogen effluvium. I've seen a lot of women come in, unfortunately, with diffuse hair thinning due to action of stress. I saw that a lot in the last year. You see another example of it on the bottom right. The two pictures on the bottom left and the top right are a picture of what we call alopecia areata, where basically our immune system starts attacking our hair, causing these bald spots, classic stress-related conditions. And then finally, something that I'm very interested in is this accelerated aging. I put the picture of Barack Obama here. This is him on the left before he started his presidency, and this is him 8 years later. You can see that accelerated aging. That is profound in terms of what 8 years can do as someone who is a global leader and having to deal with so many issues. And with aging, skin aging, a few things happen. Our skin basically thins. And there's different levels to our skin. There's the outer layer, which what we call the epidermis at the top. Then there's the dermis, which is the collagen layer. We have depletion of what we call elastin and collagen. There's the hypodermis, or the fat component, the subcutaneous, where that also diminishes, causing sagging. Our muscle layers generally don't change. If anything, they become what we call hypertrophic. Because of expression, we basically get thickening of these muscles. But there is this process of accelerated aging, again, due to inflammation from stress. So how does stress actually influence this accelerated aging? And as I've mentioned to you, there's really, again, the two pathways. There's some other interesting things that I want to bring to light for you with regards to what stress does. So one of the basic mechanisms is increased cortisol production. Our brain basically, when under stress, when under negative emotions, releases excess cortisol. When that is chronic, it leads to inflammation. Inflammation leads to loss of collagen. Inflammation can basically eat up your collagen layer, so your skin becomes thin. Inflammation can actually get rid of some fatty tissue, so your skin becomes thin. Chronic production also increases DNA damage and decrease repair. So if you have a lot of sun damage, our body has the ability to actually correct those mutations. But when you have chronic inflammation, your immune system is affected and it's not able to repair that damage. There's another important hormone called DHEA, which stands for dihydroepiandrosterone. And that is basically a hormone that is thought of to be an anti-aging hormone, but yet unfortunately with chronic stress, more of the emphasis becomes producing cortisol and less DHEA. These are both steroid type of hormones, and lower DHEA has been shown to play an association with aging. And that is, we see lower DHEA. There are people who try to market DHEA to try to tell patients to take that, to try to sort of decrease aging, but that has never really panned out to work. There's such a thing as what we call telomere shortening. So telomeres are basically ends of our chromosome. And these ends of our chromosome are, the analogy I can give you is basically our shoelace that we tie our shoes with. At the ends, there are these shoe caps, which basically prevent the shoelace from opening. Those shoe caps are what protect our DNA from being damaged. But with aging, those telomeres shorten. And telomere shortening has been shown to lead to cellular aging. So it is so important to keep our telomeres healthy to prevent them from breaking down. Here's an example of basically telomere shortening. You can see the chromosome on the left has those purplish bluish caps on either end of it. And with aging, there's telomere shortening. Once that telomere shortens, it's not able to basically protect the chromosome ends, and chromosomes can unravel. They're prone to oxidation, cellular damage, inflammation can get at them, and basically that can lead to development of disease. It can develop to certainly aging. So lengthening our telomeres has been shown to actually cause long-term survival and health. When they look at actually Mediterraneans who live to be beyond 100 and they look at their telomeres are certainly much thicker and longer. There's further evidence about how negative emotions affect rapid aging. And it's been shown that people who are experiencing stress and those negative emotions actually release certain neurotransmitters and certain chemicals at the end of our nerve endings in our skin. There is basically a neurotransmitter called nerve growth factor. There's substance P, there's neurotropins, and these have been shown to be at a higher level in patients who have stress. And these neurotransmitters that are produced within our nerve endings in our skin lead to actually inflammation. So before we get into treatment, let me just basically walk you through what exactly happens. When we are under stress, we have these negative emotions. Again, negative emotions could be resentment, hate, anger. And that basically, those feelings get processed by our emotional center in our brain. There's really two parts to our brain. There's the emotional center, better known as the amygdala, which is at the lower level of our brain. It's what I call like basement of our brain. And then there's the outer layer of our brain, which is called the cortex, which what processes thoughts. So our emotions are actually processed in a different center than our thoughts. And the issue is that when we are feeling certain emotions that we're not quite maybe aware of because it's not being processed by our higher brain center, the cortex, it gets processed by the lower level, the amygdala. So if you're sort of angry and you're not really paying attention, you're not aware, and that is sort of becomes, unfortunately, your personality. Or if you're upset and you carry that with you on a day-to-day basis, the amygdala becomes hyper aroused. And there's such a thing as what we call amygdala hijacking, because there is connections from our heart, our organs, to our amygdala. There's actually what we have more than one brain. We don't have just the brain up here, but we have actually multiple mini brains in our organ system. So when we are feeling a certain emotion, there are signals sent by the brain within each center. There's different centers. There's our sexual organs. There is our intestines. There is our basically lower intestine, upper intestine. There's our heart. There's our thyroid gland. When our mini brain in these areas, when we feel emotions, let me backtrack, I'm sorry. So when we feel emotions, our amygdala basically processes that emotion, and it activates our autonomic nervous system, which is our subconscious, which it's not under our voluntary control. So the amygdala does two things. It basically signals production of cortisol through our adrenal gland and norepinephrine, and that, as I said to you, that leads to inflammation. But then also the amygdala actually sends messages to these mini brains, and it sort of puts those centers into hyperdrive. Our body actually, the autonomic nervous system, through connections from the amygdala to our these mini brains that are located within each organ, it basically sends what we call incoherent messages to those centers, and it activates those centers as well. So there becomes this disequilibrium. There's this loss of balance. And that actually allows us to feel certain things, such as maybe a rapid heart rate, whether our digestion is affected, or whether, there could be issues with our sexual glands. So every organ system can be affected. I wanted to focus on skin. That is my specialty, but there's basically as I said to you, release of nerve growth factors, substance P, there's inflammation, there's lowered immunity within the skin, which leads to all these issues. So I hope that's an explanation. The issue is that our higher brain center, the cortex, really catches on late. There are messages sent from our amygdala, the lower brain, to the higher brain to say, hey, I'm feeling this. But by then, you already have these physiologic symptoms of whether it's inflammation. So it becomes an issue where we're actually not aware. We are not aware of what we're feeling. And so the issue is it requires we actually become aware of how we're feeling, because again, our higher brain center doesn't process that. The training, unfortunately, for majority of doctors is to treat symptoms. When a patient comes in with complaining of a rash, itching, and the training becomes, well, here's a cream, whether it's a cortisone cream or anything else, and basically use that. But my goal is to actually go beyond and help people to become aware. So now let's talk about what are some treatment options beyond medication to basically get us to become less stress. So obviously there's sleep. We know sleep is probably the most powerful thing, trying to make sure you get 7-8 hours of sleep. We live in a society where we're constantly working. We may be sleeping 5-6 hours. That is never enough. Our body never has time to recover. Our body never has time to basically repair itself. Our diet plays a part, eating a low inflammatory diet, trying to minimize sugar, try to minimize excess salts. All these things can wreak havoc on our digestive tract. It can certainly cause issues with insulin resistance, and all of that has its own issues. Exercise, you produce endorphins, so and exercise is a powerful way to feel better. And then self-care. Self-care is really about taking time for ourselves and to be able to attend to ourselves. The analogy is when you're on a plane, if unfortunately there's an issue on a plane, they always say put the mask on yourself first before you put it, let's say, on your child. So it's about attending to ourselves. We tend to sort of forget about ourselves in the process, and we may be dealing, taking care of our kids, our spouse. So self-care becomes important. And then this list is, to me, even more powerful. And one is self-awareness. I think having that self-awareness that on a typical day, if you are aware of your emotions, if you're angry, you're resentful, you're frustrated, you sort of catch yourself. They do say that top athletes who miss, let's say, a shot of not scoring, they have what's called a short refractory period, meaning they catch themselves, they're able to not get emotional, so the cycle doesn't get worse, and they're able to recover quickly and be able to just resume their play so that they can be at their peak performance. Well, it's the same thing here. It's about really catching yourself when you have certain symptoms and say, I'm not feeling good. Let me just take some time out. Let me just have a short refractory period. And then you need to constantly fill yourself up with positive emotions. And that is something that's actually worked for me on a personal level. So in the last year, again, the silver lining has been to catch my thoughts, catch my emotions. I try to replace negative emotions, as challenging as it has been in the last year, with feelings of gratitude, with feelings of love for life, joy, excitement. So I've developed a practice where now in the morning I do my meditations and I'm able to just close my eyes and just fill my heart, fill my body with truly these positive emotions of just gratitude. Gratitude can get rid of fear. Gratitude can get rid of anything that can get in your way. It can sort of bring on feelings of happiness, healthiness, joy. We obviously don't discount psychotherapy. That is probably the most powerful way to be able to actually, through hopefully an amazing psychotherapist, be able to get in touch with repressed feelings, with repressed thoughts, with suppressed thoughts, to be able to bring them to your awareness and hopefully recreate new wiring, new, what we call neural pathways. Because unfortunately, I don't want to get too caught up in the psychology of this, but these emotions are based on, unfortunately, decades going back to childhood, even maybe in utero, about these neural pathways that are formed that lead to those issues or traumas that ever happened in childhood. So it's about really creating new neural pathways and getting rid of old memories that are repressed. One thing that I find is huge is this, what I call heart-centeredness. I've learned in the last year that if I think if you're sort of in your head, you're dead, but if you're in your heart, you can actually not be judgmental. And I think there, we all have a certain element of judging ourselves, others, our circumstances. We have an element of sort of being overly sort of hyper rational, hyper vigilant. And we have sort of ways of sort of being perfectionist, and all those negativity is not good. So I think when you're in your heart, you're able to feel gratitude, and you're able to feel joy, and have empathy and compassion. And those are really parts of these positive emotions: gratitude, empathy, compassion, and not judging, because I think that just leads to sort of a bad place. There's more and more research that shows that when there's a heart-brain coherence, we actually become healthy. When our heart and brain are in sync, it's called coherence. We can actually increase our magnetic field. That's all been shown through science. And what I mean by heart coherence is that when you are feeling negative emotions, there's such a thing as HRV, which actually top athletes, peak performance measure, and that is a distance from one heartbeat to another. That when that is when you have a high heart rate variability, that means your body, your heart is kind of in sync. But negative emotions lower our HRV. So and there's actually more connections from the heart to the brain than it is from the brain to the heart. So when you fill your heart with positive emotions, you actually get it in sync. And then with brain coherence, it's about lowering your brain waves. When we are actually in high stress modes, we actually, what we known as beta brain waves. So we want to lower that to what's called alpha, delta brain waves. So and positive emotions are able to basically allow our heart and brain to talk to each other. And when you actually create that, you can actually really heal yourself. You can heal the acne, you can heal the rosacea, you can improve your immune system. And that's what meditation does. And the goal of meditation is to really create an ability to have what's called heart and brain coherence. When you fill your heart with positive emotions, when you're able to just be at the present moment, to put aside all these thoughts that our body produces, and basically be able to almost what I call tame the stallion, which is our body, which is kind of running wild. If we're able to just sit quietly in the morning for literally a half hour, the more the better, and able to just clear our head. As much as our head, there's mind chatter, and our sort of mind takes over and tries to think about all the things we have to do for the day, or all the things that has happened to us. When you sort of bring your mind to the center and you're able to calm your mind, you actually calm your body. And then when you fill your body with positive emotions of love, gratitude, you can actually really heal your body. You can actually get your autonomic nervous system to be in balance. You can actually help reduce cortisol production. You can actually calm your amygdala and create new neural pathways. And that is what meditation has taught me. As a Western trained physician, I didn't really believe truly in any of this stuff, but over the last few years, especially in the last year, I believe in meditation so much. And I think when you can actually in meditation, what I do, something that's helped me, is that I'm able to bring my head into focus, calm it down, to be able to think about the present moment, almost be in a blank space. As much as my mind wants to fight me and take me to all the issues that has happened to me, all the stuff that I have to deal with, I try to calm it down. It's challenging. It is super challenging. I have not perfected it, but I'm studying it every day. And then when I then fill my heart with positive emotions, and then I'm taking deep breaths, which, as I'm talking to you, I realize I'm not actually breathing right now, but that is the power of breath. And when you actually take time to close your eyes, to create heart-brain coherence, and you do it through deep breathing through your heart, that deep breathing actually activates your parasympathetic system, which puts everything in balance, because we tend to be in fight or flight all day with our work, with kids, with relationships. So it's about really training yourself to take deep breaths, even if it means in the course of a day, 2 to 3 times a day, Just take 2 minutes and just close your eyes and just take deep breaths through your heart and through your heart and think good thoughts. It makes all the difference. And I think that can really lead to disease. I kind of try to simplify my talk. There's a lot more I can talk to you about, the science behind all of this. Um, but I'm so fascinated by the combination of new findings in neuroscience about how stress leads to disease, combining that with what I believe is really spirituality, enlightenment, Eastern medicine, to really help us not to be as much reliant on this, let's say, medication. And that, I think, there's going to be a paradigm shift over the next decade in medicine, because there's so much more than just treating our symptoms with a medication. So I just wanted to share that with you. Um, this is a quick slide that I just want to go over with you. It's about how do you go from depletion, when we're depleted, to renewal. On the left, if you look at the left, is where we have negative emotions. With negative emotions, we have increased cortisol production. And these negative emotions could be, on the left, anger, anxiety, frustration, resentment, apathy, sadness. And that leads to inflammation and disease. Our autonomic nervous system gets aroused. It's imbalanced. It's not in balance. Versus to the right, this is what we want to shift towards, renewal. When you have feelings of happiness, excitement, love, appreciation, contentment, serenity, we tend to be in more brain heart coherence. That can be measured through HRV. It can be measured through brain waves. Our autonomic nervous system comes into balance. There's equilibrium. Your fight or flight response is not overly active. You have less cortisol production, more DHEA. You have less inflammation in your body. And then this has also been studied in psychology, is what's called the vortex of positive emotions. And what the vortex of positive emotions, there's also a vortex of negative emotions, is when you think one positive thought, you can actually all of a sudden notice that you can build on that positive thought and good things happen. So you almost get into a vortex and go up. And there's studies that show that for every one negative emotion, you need to actually have 3 positive emotions to combat one negative emotion. And you can kind of see the power of negative emotions. They're kind of detrimental. If you have one negative thought, all of a sudden you see that your life can kind of just get worse and worse for the day, or the day gets worse, or there's the vortex of negative emotions, which takes you down. So it's about taking us up, producing more positive emotions, more positive experience, and there's this upward spiral. So that's the talk. And please, I hope you have a chance to enter some questions. I want to really go over them with you. Let me just share. Let me get rid of stop sharing my screen. And I would love for you to if you have any questions, let me see if there are any here. And please enter your questions if you can. And I hope this was something that interests you. I sometimes have certain feelings that I wonder whether people think this is crazy for a dermatologist to share this, but I am fascinated about personal development, about growth. I'm fascinated about how can I make myself be in a peak performance for my patients, for my family, for my kids. And I find in the last year, the silver lining with COVID has been exactly this. It's about being aware of the thoughts that I'm experiencing and catching myself. It's about really catching myself. And I find having that short refractory period has truly helped me in terms of being in that vortex of taking me higher. So, it's not easy because we get hijacked all the time. And the problem with getting hijacked is that it is not something that our brain processes, because it gets processed through the emotional center, the amygdala. So we're not conscious of it. But next thing you know, you're actually feeling symptoms of rapid heart rate. You're feeling symptoms of not being able to breathe properly, or you have digestive issues like irritable bowel. And the same thing goes with the skin, where our acne gets worse, our rosacea gets worse, because it's not in our voluntary control, because our autonomic nervous system is activated. We're producing cortisol, we're getting inflamed. So that awareness can really long-term lead to worse disease, whether it's, God forbid, it's heart attacks, whether it's cancer or things like that. So let me just basically go into the Q&A. And again, the sort of conclusion is about how positive emotions combat that, and it actually provides a more beautiful day for all of us. So one question, the first question here is this: will fillers and other cosmetic treatments still work for people with chronic stress? So when we're under stress, we are talking about how it leads to aging. Um, and obviously, self-care falls under fillers and cosmetic treatments. They will still work. Fillers and cosmetic treatments are not permanent. And that is one way where we're able to make ourselves look better. And when we look better, we actually feel better. There are actually studies, ironically, that shows that Botox can actually help with depression. And I love that study because it shows that it's not actually just about looking better that makes us feel better with Botox, but Botox has actually been shown. There's actually major studies that show that our physiology affects our mood. So when we're kind of crunched over, we're sitting down, or when we're like sort of using our muscles, we're angry, that physiological state can cause neurotransmitters to be released that make us feel bad. But ironically, Botox has been shown that when you actually relax these muscles that are in hyperarousal, you stop the production of certain neurotransmitters. So it's more than just like sitting upright, which helps, but when your muscles are relaxed, you actually produce less neurotransmitters, and this has scientifically been proven. So ironically, these cosmetic treatments, they do more than just make us look better and therefore feel better. They can have a physiologic response. I love the fact that in the last year, patients are taking care of themselves. I've seen many patients who've come in, whether it's through Zoom, the Zoom effect, or anything, that their people are taking care of themselves. And that's something that I am glad people are finding whatever works for them. So another question here is, how can we slow down the process of collagen loss? So the process of collagen loss is fascinating. And one way, the most important way, is being careful with sun. So sun avoidance is critical because we can't, there's two types of aging. There's intrinsic aging, which just happens naturally, and intrinsic aging gets affected by stress. There's extrinsic aging, and extrinsic aging happens to do with our diet, with our with environment. So environmental factors, you want to be careful with the sun. You want to moisturize your skin. Moisturizing is critical for collagen maintenance. You want to be able to use some retinol if you can to help boost some collagen production. We can actually slow down the process of aging extrinsically as well through diet. So basically making sure you watch your sugar intake. Sugar has been shown to be a toxin because it methylates your collagen and therefore it causes it to be depleted. So those are things we can do. And then there's intrinsic stuff. As I mentioned to you, making sure you get enough rest, making sure you're exercising, making sure that you're thinking good thoughts. I think you reduce inflammation that way in your body. Collagen loss happens gradually. The studies have shown that unfortunately, once we hit the age of 30 to 35, we lose 1% of our collagen no matter what a year, but we can slow that down and at least not accelerate that. So I hope that answers your question. Another question was, do epigenetics affect how fast we age? So we talked about how epigenetics is the study of the environment on our genes, that we tend to think that we are predestined for certain diseases, and that is absolutely not true. 90% of cancers are environmental. Very few things. There's certainly cancers that are caused genetically, but they account for a minority of cancers. So our environment, it's fascinating how it affects us. So we know how sun causes skin cancer. We know that basically eating high fat diet can lead to colon cancer. So there are these associations. We know smoking leads to lung cancer. But yet epigenetically, you can modify that behavior. And that is to, epigenetics is also the study of actually beliefs and how beliefs affect us. So if you're thinking negative beliefs, if you're thinking negative thoughts, you can affect your genes. Your genes can, you can actually cause basically certain genes to be what we call upregulated versus downregulated. So without a doubt, our brain is so powerful. It is so powerful how it can help us to elevate us, um, or versus do the opposite. I've seen patients who truly, like, are 75 and they look like 55. And when you sort of, you see a pattern, and those patients basically just have a great attitude. They have a great outlook. They're optimistic. Um, they've done their Botox and fillers, which is beautiful, but yet it is still their attitude. I've seen people who unfortunately are 50 and they look like 70. So it really is important. The beliefs, the perceptions, that's really powerful. Um, Another question here is, will meditating help reverse the aging process? I think meditation, what it does, it basically just calms us. And by calming us, we can actually change our brain chemistry. And when we change our brain chemistry, we can be more healthy. We can, there is a process in neuroscience called pruning and sprouting. So there are neural pathways between our nerve cells called neurons, where you can sprout new connections. And so therefore you can actually, with just your thoughts, you can create new connections, and those can lead you into the part of the brain that makes you more stressed and releases bad chemicals. Or you can actually sprout new connections to a portion of your brain that creates more creativity, that creates more empathy. And so those neural connections, that's why there's such a thing as what we call neuroplasticity, where we can generate new connections. Pruning is taking away. So there's studies that show with positive emotions that you can actually decrease through MRI, what's called functional MRI. You can actually see parts of the brain that are responsible for anger, frustration, hate, be less active. And then there's portions of the brain that are responsible for just empathy to be actually more highlighted. There's another question here. It says, have you seen stress play a part in how someone's wound heals? So that's a fascinating topic, actually. So I have actually seen that. It's been shown that, and this is scientifically studied, that actually wound healing is compromised with people under stress. And that is because of a mix of inflammatory cells that actually slow down the healing process. So studies say that that happens, and I've seen it in my practice. There are people who are optimistic, they're just have elevated emotions, and they just heal beautifully, they heal well. And then there are people who are under stress and their wound healing can be compromised. It says something about, another question is, you mentioned longevity in Mediterranean people. Is there something in particular that they do to help with the aging process? Absolutely. So that's a great question. So what do these people who live in villages of Italy or Mediterranean do that they live to be 120? So for sure it's their diet. So their diet, I think, is important. It's rich in antioxidants, omega-free acids. They're certainly eating food that is not processed. So nutrition plays a part. Their diet plays a part. They're eating a lot of just unprocessed healthy foods. And I think the other thing is they're just less stressed. They're in nature. They don't have complicated lives like we do in an urban environment. And they tend to just, I think, have a good attitude. They're just happy, content people. And I think their autonomic nervous system is not out of whack. They're not dealing with so many things coming at them. They're just content. They're of gratitude. And I think they just enjoy life, less complicated life. Okay, here's another question. Someone asked, actually go here. So sorry, just one second. Here we go, a lot of questions. I want to be able to answer them all. Okay, so someone says, how important is sweating to have healthy skin? I'm thinking of a workout where you really break a sweat. So how important is sweating to have healthy skin? I think sweating is important for your health. Um, I think as a result, it is then really important for having a healthy skin. If you're not sweating, basically you certainly build up toxins in your body, and those toxins can basically potentially lead to issues. Some people sweat a lot more than others. I don't think that matters. I don't think the intensity or the level of sweating is important, but certainly if you're not sweating, your body heats up. When your body heats up, your blood pressure can go up. You can build toxins. Um, you don't necessarily need to have an intense workout to and break a sweat to be healthy. I actually find that um, as a negative emotion, believe it or not. I actually see that as we think the more we do, the better we're going to be. And that is not true. That actually creates stress. So to me, to have a great workout, you don't have to sweat. So you can actually just be, sometimes I find, you know, um, there's a saying that says path of ease and flow. It's really about you don't have to kill yourself to be healthy. So it's about even a 20-minute stretch workout can keep you healthy. So I don't think you have to sweat. It's good to sweat, but as long as I think you have a positive outlook, you're stretching your muscles. It's been shown that stretching is far more important than necessarily doing like a heavy aerobic exercise. It's what keeps our muscles and joints kind of flexible. So the other question is prescription retinol better than one we can buy over the counter? So retinol doesn't need a prescription. There's different concentrations of retinol. And again, it's actually the same thing. Believe it or not, the higher the concentration is not necessarily better. It depends on the patient's skin type. You have patients who have really fair, sensitive skin, and strong retinol will actually make you break out. And then there are people with oily skin who can tolerate a higher concentration of retinol. And then there's retinoids by prescription, which is what we call retin A. And I find yes, that is true. I think retin A by prescription is absolutely great. The problem we have in our country is that retin A by prescription gets really exorbitant, and I certainly I offer it to my patients, but sometimes they say, "My God, this is so crazy," and I find it's not unfair the price that is offered. And then so there are retinols that are available without a prescription, but they truly still work. They may not be as great as retin A, maybe they're a little bit lower, but they still do the job, and they're significantly less costly. But certainly over-the-counter retinol is still good. Another question is, does face massage help with muscle atrophy and asymmetry? Great question. This is something that you see on social media now, and it's sort of gained traction. And I don't believe that to be the case. I don't. So ironically, I feel like if you're doing facial exercises to strengthen your muscles, you're actually going to potentially cause more lines because you're making expressions. And that happens why Botox becomes so effective, because naturally we're making expressions where we're frowning, where we're elevating our eyebrows, we're squinting, or we're kind of like biting down. Let's say I've seen a lot of people emotionally, by the way, get kind of box-like jawlines because they're stressed at night and they're kind of like clenching their teeth. So I find facial muscle exercises kind of strengthen your muscles, and as a result, pull down on your skin and lead to wrinkles. So what I find to be the case is, sorry, let me get rid of that. So what I find to be the case is that aging is not due to muscle atrophy. Our muscles actually do not atrophy much because we're constantly using them. We're talking, we're chewing, we're speaking. So aging is really not due to a thickening of our muscle. Really, that jowling you see has to do not from muscle stretching, but from loss of fatty tissue. It's the connective tissue above the muscle that's diminished. And it's that connective tissue that connects our muscle to the skin. And when that area is thinned, it is not able to support our skin, so that when we are talking and moving, as our muscles get stronger, the support for the fatty tissue in the skin is no longer there, and then the skin just falls down. So it's not an issue of muscle thinning. So doing facial muscle exercises, I don't think does anything. If anything, I think you can thicken your skin and kind of cause more wrinkling. Another question is, can you cure an illness based on belief alone? Have you ever seen someone miraculously recover from an illness? So this is fascinating. So this is an incredible question. It requires a whole hour to talk about this, but uh, I think, how do I answer this? So can you cure an illness based on belief alone? I think to an extent you can. Our beliefs are powerful ways unconsciously that can lead to disease. And I think if we can be an optimist, we can cure certain illnesses. There are multiple case reports in the scientific literature of people curing themselves of cancer, not just skin cancer. I'm talking about colon cancer, breast cancer. There are cases of multiple sclerosis being cured. And I find this is something that Western medicine needs to study more, because I think there's a pharmacy within our body. There's a pharmacy that our brain can produce. And that elixir is more powerful than sometimes a lot of medications. And I may be going off tangent here. I'm putting myself, on a thin rope here, but I don't want to discount Western medicine. I'm a doctor, so I would never say don't listen to your doctor. And I think I've seen within my practice 2 patients with metastatic melanoma that is all over their body, and they are still alive, one 15 years. It's a lady, and I've seen a man who basically having metastatic melanoma, and his metastatic melanoma is just shrunk. And in both cases, it is their attitude, it's their outlook. They're just like happy-go-lucky people. And it's not something I see in my patients. My patients are generally very stressed. So I cannot tell you the power of our beliefs. So I think if you're just surrender, and I'll be honest with you, it may sound a little corny, but when you surrender to love, when you live in an incredibly high elevated emotional state where when you're in your heart, you can just accomplish so much in terms of taking care of yourself. So when you just surrender and you're not judging, and you're not living in fear, and you're just kind of accepting of what it is, and that takes a lot of training. But in both of those patients who are still alive, it is so obvious to me the pattern where they're just like, they don't believe in what they have, and they just kind of like, they certainly have had treatment, by the way, don't get me wrong. They've had immunotherapy, but that immunotherapy for a lot of people may just prolong survival, maybe by 3 to 6 months, but these are people who are like just doing so well. Okay, any other questions? Um, all right, so that's it. I really appreciate your time here. I hope this was helpful to you. It is really, for me, going off tangent from something that I do on a daily basis, which is do cosmetic procedures with fillers and Botox. But this is something that's a subject that I'm so fascinated by, and I just wanted to share that with you. And I'm just excited to study this more, and honestly, one day I hope to write about it, because I want to utilize my 25 years of experience to hopefully pass that message along. I feel like if I don't do that, I feel like I've done a disservice. So anyway, with all that said, I wish you all the best, and I'm glad things are getting better. Don't forget, be optimistic, positive emotions, and love to everyone. Thank you so much.